Hi, and welcome to this mini-gem brought to you by the Association for Elderly Medicine Education. My name is Dr. Kate Howorth, and I am a Clinical Teaching Fellow with Northumbria Healthcare Trust in the northeast of England. Today I will deliver a short presentation about dementia and how it is relevant to your work as doctors in Africa. During this talk, I first want to give some statistics to demonstrate that dementia is an increasing problem in Africa and a condition you are likely to see a greater amount of in the future in your clinical practice. I will then explain what dementia is and its key characteristics, followed by its impact on patients and those around them. Finally, I will discuss how we can manage a patient with dementia. Non-communicable diseases have become the leading cause of death globally and are an important cause of morbidity. Dementia is one of these. 35.6 million people suffer with dementia worldwide. More than half of dementia patients currently live in low and middle-income countries, and a recent study in Tanzania found a prevalence rate of 6.4%. Prevalence is increasing, and if the current growth in the older population continues, it is estimated that 71% of dementia patients will live in low and middle-income countries by 2050. Dementia has therefore been recognized globally as a public health priority by the United Nations, World Health Organization, and the group Alzheimer's Disease International. Current studies are also thought to under-recognize the prevalence of dementia. Reasons for this include adequate diagnostic assessment, poor access to medical care, and possible hiding of cases due to stigma of mental disease. Dementia is a condition characterized by deterioration in cognitive function. It affects higher cortical functions. These can include a decline in memory, particularly difficulties learning and recalling new information, problems with comprehension of language or non-verbal information, and poor executive function, such as the ability to plan, problem solve, and reason. Behavioral and psychological symptoms are common. These include depression, anxiety, altered sleep patterns, reduced motivation, and psychotic symptoms. It has a chronic and progressive nature. Advancing age is the main risk factor for dementia. After the age of 65, the prevalence of dementia doubles every 5 years. This is particularly relevant in Africa, where life expectancy is rising and the population is aging rapidly. The mini-gem, Africa's Aging Population, covers this in more detail. Stroke and vascular factors increase the risk of dementia. These include obesity, hypertension, type 2 diabetes, and hypercholesterolemia. There are a number of environmental factors which are thought to be risk factors for dementia. These include excessive alcohol consumption, social isolation, low education levels, and dietary factors. Worldwide, there are some genes that are associated with the development of Alzheimer's disease, such as the apolipoprotein E gene. However, this does not appear to increase the risk in sub-Saharan Africans. There are a number of causes of dementia. Some clinical features are more prevalent in one cause than another, and they can vary in clinical course. Alzheimer's disease is the most common cause of dementia, worldwide and in low and middle income countries. It accounts for 60 to 70% of cases and is caused by cortical amyloid plaques and neurofibrillary tangles. These plaques cause an inflammatory process that ultimately leads to cell death. Vascular dementia is the second most common cause of dementia, accounting for 20 to 30% of dementia cases. It is caused by reduced oxygen supply to the brain due to repeated strokes or other pathology in the blood vessels. Data for other causes of dementia in Africa is limited, but frontotemporal dementia and Lewy body dementia are thought to both account for about 5% of cases. Dementia impacts the patient in a multitude of ways. It causes considerable morbidity and ill health, impaired quality of life, and reduced life expectancy. It also means they are more dependent on those around them and can therefore have financial implications. Dementia can cause distress for family and have financial implications if they are no longer able to work due to needing to provide care. Due to all the reasons discussed, this is likely to put a considerable strain on health services, which are usually already under-resourced. Therefore, it can cost the patient, family, and healthcare system. Patients are diagnosed with dementia through a combination of a history of cognitive impairment from the patient and family with positive psychometric testing. These tests are a way of measuring a patient's cognitive abilities and identifying any impairment in them. There is no standardised screening tool for dementia, and many of the screening tools used in the UK are not applicable in Africa due to cultural and literacy issues. However, the IDEA study, which stands for Identification and Interventions for Dementia in Elderly Africans, recently developed and validated a screening tool for use in older adults in sub-Saharan Africa to identify those with dementia. This is hopefully a quick, easy tool you could use in your practice to identify those who are highly likely to have dementia and therefore need a more detailed review. It is free to use and can be found at www.ideastudy.org. There is no cure for dementia, so management is focused on symptom control, support, and prevention. Cholinesterase inhibitors, such as donepezil, are used in Alzheimer's disease to slow the progression of symptoms. It is also important to avoid drugs which could worsen confusion. This is covered in the mini-gem about delirium. Raising awareness amongst the medical team is important, as is educating the patient and family about dementia's chronic nature and progression, and the cause of dementia to combat stigma. Family support is important, including advice about social support if available. Managing risk factors such as hypertension is an important part of prevention. On a larger scale, national strategies are needed to increase awareness and resources, enhance social provision, and provide specialist training in dementia, but this is out with the coverage of this talk. We would be really grateful if you could complete this survey to tell us what you thought about the mini-gem and how we can make it better. It will only take a couple of minutes. Just click on the link at the end of the mini-gem. So in summary, I hope this mini-gem has helped you appreciate that dementia is becoming an increasing problem in Africa. Hopefully you can now recognise the key features of dementia, understand the impact it can have, and have an idea of what to do about it. Thank you.